Okay, the recording started. Sorry about that. So let's go over some quick definitions. These are definitions that we go over with the facilities and all of our trainings. So DDS stands for Department of Developmental Services. DHCS is, of course, us, the Department of Healthcare Services. EHD, exempt hospital discharge. Um, IDDDRC is under DDS. So they're the ones that govern the IDDDRC process. That stands for Intellectual Developmental Disability and Related Conditions. I already mentioned what PASS-R stands for. Just a little hint, PASS is the pre-admission screening and RR is the resident review. SMI, of course, stands for serious mental illness, and of course, SNF stands for skilled nursing facilities. Some definitions that we also have here, they're very important for when things are supposed to happen in the PASS-R process, is when we refer to individuals as new admissions, readmissions, and inter-facility transfers. These three definitions determine when a pass needs to be done and when an RR needs to be done, and more specifically, if the hospital's supposed to do something or if the SNF is supposed to do something. So I'll mention why that's important a little bit later when we get to our flow for the level 2 process. So we also have the definition for serious mental illness. This is a shortened version. I'll show you the extended version on the webpage. But this same definition is also on the level 1 screening. So when the facilities are submitting their level 1 screenings, if they're unsure what we mean by serious mental illness, they have this definition that they can hover over. It's like a little tooltip. It's an icon that they can hover over, and then the definition pops up. Um, but this is a good determining factor on whether or not someone that they're submitting the screening for has a serious mental illness, possible serious mental illness or not. The instructions, more specifically at the bottom, where it mentions functional limitations and major life activities within the past 36 months, and then intensive treatment. If they don't have that, if they don't match that definition, then they technically don't need to list the SMI on the level 1 screening. So if you guys ever see a level 1 screening and you see somebody has a diagnosed mental illness, but it's not listed on the level 1, it's possible because of the end of this definition, it doesn't qualify according to PASS-R regulations. Significant change is another important one. Just keep in mind that significant change can be a decline or improvement for the person's status. This is one of the reasons why a resident review would need to be submitted by the skilled nursing facility. So for significant change, they're generally following these 3 rules here, and it's up to them on whether or not it needs to be submitted. And then we have the definition for 30-day exemption. In a nutshell, there's 3 criteria that need to be followed. All 3 must apply in order for the hospital to use the EHD. And the most important one is the attending physician certifying before admission that the individual, to the best of their knowledge, doesn't need to be in the SNF for more than 30 days. This is the important factor for the SNFs. That information should be producible by the hospital if anybody asks for it. And then the SNF's job is to make sure that the RR is done if they know that the person's going to be there longer than 30 days or if they think the person's going to be there longer than 30 days. So we tell the SNFs, if you're still within that 30-day window, so that 30 days starts on the day of admission to the SNF, if they're still within that 30-day window, they can go ahead and submit the RR if they think the person's going to be there longer. If they're not sure and they're on the 30th day, the field office, who reimburses the skilled nursing facilities, gives them an additional 10 days to submit the RR and have it complete. So we tell the SNFs in all of our trainings, if you guys are on the 30th day, go ahead and submit that RR because you need to make sure it's closed within that additional 10 days they get. So the purpose of PASS-R is to ensure anyone with a qualifying SMI or IDDDRC gets evaluated to determine if there's services or support that they need that goes above and beyond what the SNF would normally provide. So the level 1 screening, in a nutshell, is just a screening to see if there's possible SMI. So even if the screening is possible, it's not guaranteed that somebody needs an evaluation, which will lead to a determination. But everybody going into the SNF, of course, needs to have the PASS-R done before admission. And we do have the regs here. The federal regulations are pretty generic. And the way it works is each state has their own way of interpreting the regulations. So California does it a little bit different than Florida. then Texas, so on and so forth. But the general idea for PASSAR is anybody being admitted to a Medicaid certified SNF needs to have the PASSAR done regardless of their insurance type. So that's all we care about. We don't care where they're coming from. We just want to make sure that the PASSAR is done before admission. And in California, we have several different ways of making sure that that is done. So the general flow for the PASSAR process is it all starts with the level one screening, and there's two processes that run congruent. So there's the SMI process, which you have on the screen here, and then the next slide will be the IDDDRC process. They both start with the exact same level one screening. So it starts with the facility, whether it's the hospital, the SNF, whoever is doing the level one. They submit the screening. And then as we go through the flow here, if at any point the answer is no or negative, then the screening closes and then the PASSAR process is done. So if the screening is positive, meaning that there's a possible serious mental illness, then it goes to our contractor, which right now is Acentra. Acentra takes a look at the level one. They ask additional questions to the facility staff to determine if an evaluation is necessary. If they determine that one is necessary, they'll schedule that evaluation. It could be face to face, it could be via telehealth. Um, Once that evaluation is done, they submit that information back into our PASSAR system, and then that information is turned over to our clinicians. So our clinicians, by law, by federal regulations, are not allowed to do the evaluations. That's why we have the contractor, because it has to be a neutral third party that does the evaluation. So the clinicians take that information they got from the evaluation from the contractor. They produce the determination based off that information, and then the determination is submitted in the system, and the facilities have access to it. Um, the determination has recommended specialized services. It's up to the facilities to determine if the person qualifies for those services. And that's because, you know, the clinicians, the contractor, we're not with the folks every single day. So the staff in the facilities have the best understanding, since they're face to face with the individual, to see if those recommended services are applicable to the individual. So most of the screenings that we get, an overwhelming number, it's well over 60%, close before it even gets to the contractor. The close is negative because there's no logic on the level one. There's no triggers to say that there's a possible serious mental illness. The next chunk is still a pretty big number. Most of the screenings that get to our contractor never get an evaluation because our contractor looks at the information and determines that there's no need. And then a very small percentage actually get the evaluation and get the determination. So if you guys ever see positive screenings, just keep in mind it does not guarantee that a determination was done. It's very possible they have what we call an attempt letter, which means the screening was positive. It got to the contractor, they determined there's no need for an evaluation, and those usually close as attempt no SMI. So next we have DDS's process. So it starts, like I said, with the same level one screening. So the questions on the level one that trigger the process for DDS are in section two. I believe it's 5 questions right now. And the way it works is once the entire screening is submitted, if any of the questions in section two are marked yes, it's automatically sent to DDS. DDS will take a look and determine if they need to follow through with the IDDDRC process. So it's very similar. If anything's positive, then it moves on. If the result is no or negative at any point, then the IDDDRC process is done. So instead of a contractor, Acentra, DDS works with the regional centers. So if the screening's positive for IDDDRC, DDS are the ones to determine if the level two is needed. If they determine that it is needed, then they send it over to the regional centers, and the regional centers are the staff or the ones that do the IDDRC level two evaluation. Once the evaluation is done, then the regional center produces what they call the PASSAR summary report, and this is the equivalent of the determination letter for the IDDRC process. So once that's done, DDS staff will upload the summary report back into the PASSAR system. So it'll be in the same place for the facility as their letters for the SMI process. So the attempts, the level one screening they submitted, any letters that are generated, they all populate in the same place in the system for the staff. So we always tell the facilities the level one screening is based on medical records as well as direct observation from the staff at the facility. We always recommend that staff who are submitting level one screening should have at least met the person that they're filling out the screening for once. There are two types of screenings. We have the initial pre-admission screening, so that's done by the hospital or the facility that's discharging to the SNF. And then we have the resident review, and that's a status update, and that's always done by the skilled nursing facility. In rare occasions, if someone's coming from the community, so there is no facility that they're coming from, or if they're coming from out of state, the skilled nursing facility can do the pass. The key thing for them is just making sure that the case is closed or the pass-R is closed before they admit them. So like I said, the hospital is responsible for doing the pass. Um, they're in charge of making sure that all the information is accurate to the best of their abilities before getting that case closed and sending it over to the SNF. And we do have a system in our pass-R system that allows the hospital to send the completed case, so the entire pass-R case and all the letters attached directly to the SNF that they're discharging to. It's a two-party system, so somebody has to send it, and then somebody on the other end has to accept it in order for the transfer to happen. And once it does happen, the hospital loses all records of that case, and then the SNF takes ownership of all that information. Um, so like I said, the SNF is required to do the pass only when somebody is coming in from the community or from out of state. So the hospital, like I mentioned, does not do the RR because at that point, the person's already in the skilled nursing facility. The SNF would do an RR for any significant change in condition. And this restarts the entire pass-R process. So again, if the SNF submits an RR, the screening's positive, that does not guarantee that an evaluation needs to be done. It is very possible that that screening will close without the need for an evaluation. So by law, like I mentioned, a third-party contractor has to do the level two evaluation. It has to be a neutral third party. So that is Acentra. They were formerly known as Keypro. So if you guys remember that name, it's the same group. They just had a name change. And like I said, for the IDDDRC process, the regional centers are the ones that do the level two evaluation for DDS. The evaluations, like I said, can be done face to face or via telehealth. It's whatever is best for the facility, whatever easiest for them. So the determination, like I said, is issued by the consultant psychologist. They produce it and it populates in the system. Um, the IDDDRC, same thing. Regional centers upload that into the system, and then the staff have access to it once the case is closed. So the time frame, this is the fun part. Federal regulations state that we have 7 to 9 days, and I don't know why they don't just say 9 days, but 7 to 9 days for us to get the pass-R process done. However, when we were becoming pre-admission compliant, we worked with the California Hospital Association and found out that their average for the stay in the hospital is about 3 to 5 days. So that's what our goal is. Our goal is to get the pass-R process done within 3 to 5 days. And at the moment, we are hitting that mark. As you can imagine, if the screening's negative, it closes right away. So, I mean, it don't take that moment for staff to submit the screening and for it to close. So we do have an appeal process. So let's say someone submits a screening, they have a place in mind for the individual to go, like everything's lined up, and the determination that's produced at the end says that the level of care that's recommended for the individual is a sniff. But let's say the person's already lined up to go to an STP and everything looks right for that person to be in the STP setting. The hospital staff and the SNF staff have the ability to submit a reconsideration. The reconsideration basically says, I disagree with something that was done with the pass-R process and I want to change something. So it could be a change to the specialized services. It could be a change to the level of care. Whatever the concern is, the staff do have the ability to submit a reconsideration in the system. So once they submit that reconsideration, it can only be submitted for closed cases, and the case has to be closed within 90 days. They can write what they would like changed or what they would like to see. They submit that to us in the system. We send it to our clinical psychologists. They review the information, and then they can make the choice that they agree with the change or that they disagree, and that the original determination or the original conclusion is what they think is the best option. So most of the reconsiderations we have right now are level of care changes. So like I said, if somebody goes into a sniff, they think the person is best suited in STP, they can submit a reconsideration asking for that change. They provide all the details they can for the CPs, our clinical psychologists, um, explaining why they think that change needs to be made, and then our CPs can take a look and make that decision. Most of the time, they follow through with the recommended change because it makes sense, but every once in a while, they do stick with the original conclusion for the case. So if the facility staff or whoever submitted the reconsideration doesn't like the results, let's say they wanted specialized services listed and RCP said, no, the person doesn't need that, and they disagree with that result after the reconsideration, they can request a state fair hearing with the California Department of Social Services. Um, there's a number that we give facilities. In all my time with PASAR, I think I've only seen one or two cases go that far, but that option is there if the staff or the patient or whoever wants to use it. So next we'll go to the managed care plan. So the managed care plans went into effect May 1st, 2023. They play a role in the PASAR process. As the payer source, they're responsible for authorizing long-term care for services that result from the PASAR process. So um, in the setting for the SNF, but let's say the hospitals. The hospitals, once the PASSR is done, they're supposed to send the PASSR documents, so the resulting letters and screening and all that, to the managed care plan to allow the managed care plan to approve the admission into the skilled nursing facility. Once that's done, then they can send the person on over to the SNF, and everybody's happy. For the SNFs, they would have to do this if they're admitting somebody from out of state or from the community setting. So there's information like the MDS and the MC 171 and all the PASSR letters. All of that needs to be submitted to the managed care plans in order for them to take a look at everything and approve it. So the managed care plans, in a nutshell, their role is to look at that PASSR information and just make sure that the requesting SNF is authorized, that they're okay with that. Um, it just ensures that the members are receiving the most appropriate care and ensures that the physical and mental health needs are both advantageous for the MCP and their member. So when the MCP authorizes services resulting from the pass-out determination, the member has the best chance of receiving the care that they need in the setting that is expertly deemed most appropriate for them. Specialized treatment options for members with an SMI or IDDRC are more abundant when the member is placed in the right setting, which can lead to a better physical and mental health outcome. So we have some resources, the all plan letter 24009, um, and then the information notice 23002, and these are on our PASSR webpage. But and I'll show you where that is after we do the slides and we ask see if you guys have any questions. But you guys have resources that we can show you where you can read over the details on this. And then, of course, if you guys have any questions, you can reach out to us and we can answer them. Some other resources that I'll share when we get to the web page. So we of course have the main web page for DHCS that has information notices on it. The information notices are basically policies that we've set. So anytime we have an information notice or a new policy, we send an email out to all of our partners. We send an email out to all the active staff in the PASSR system, so everybody's aware of rules, regs, and how things are going in California. And then, of course, we have our FAQs. So a lot of questions that we got when we were onboarding the hospitals, when we we're becoming pre-admission compliant, we put together an FAQ based off of that. And we recommend in all of our trainings that staff visit the FAQs first for any questions they have. But of course, if they have any other questions, they can reach out to the team and we can help them out. So we do offer monthly user trainings. We offer personalized trainings like this one. So if you guys want to do this again, or you want to focus on anything in particular, just let us know and we can schedule something. We have training tutorials, so we have videos that folks can watch on how to do certain things, like how to fill out the level one screening. And then we have online reference materials, and those are PDF documents that everyone can download at any point. For contact information, we generally point everyone to IT Service Desk. IT Service Desk is the best way for us to track the questions that come in, and they're state staff, so they work Monday through Friday from about 8 to 5. Um, but of course, if you all need to reach out to me directly, that's fine. We can do that. And that is basically it. Are there any questions you guys have? Anything specific you want to go over before I show you the webpage?
Doesn't sound like we have any questions.
That could be a good or bad thing. Okay, so I'll go over the webpage. If you all think of anything, just let me know. So this is the web page, and I'll put the link in the chat just in case you all have access to it. All right, so we have a newsletter. Anytime we think staff or any facilities need to be reminded of anything, we'll produce one. So as you can see, we haven't had one for a while. But any newsletter we have, you can go back and read them here. And like I said, it could be reminders on certain things. Like for example, when the hospitals were onboarded, that's when we introduced that file exchange feature. So we're reminding folks that when they're discharging to the SNF, they need to use the file exchange so that the SNF can receive all the documents necessary. Because what was happening is the hospitals, since they were new to PASSAR, would discharge everyone to the SNF. In the beginning, we told them they had the option of sending over like a fax with the PASSAR or use the file exchange because we wanted them to get used to it first. And the issue we had is when they would send a fax, they would only send the first page of the level one screening, not the entire thing. So now it's mandatory for all staff using the file exchange or discharging to the SNF to use the file exchange. And little updates like that we put in the newsletter. The MCP information that I went over, we graze over that here a little bit. We have general information about PASSAR, so like the regs, for example. If folks want to Google that, we give them the numbers here to Google. We go over the level one screening, level two, and determination very briefly, but as you can imagine in our trainings, we dive a little bit deeper, specifically the level one. Contact information. So we tell the facilities when they're reaching out, if they have general questions, they can reach out to IT service desk. Again, the way that works is there's an IT team. They take the questions. If they can answer them themselves, because they do have some PASSR knowledge, they'll answer them right then and there. If they can't, they create a ticket so we can track it, and then they send that ticket over to my team, and we answer the questions there. We have an on-call schedule, so if a facility has an emergency, say for example, earlier this year, it was like a couple months ago, there were a group of hospitals that lost their power, if I'm not mistaken, or that no, they lost their internet and their phones. So we worked with them to help them get their PASSRs done until they were up and running, but that was a good use of the on-call schedule. And the on-call schedule is a rotating a pair of numbers, management staff or PASSR, and yeah, we take whatever questions come after hours or on weekends and then help out the facilities with whatever they need help with. Then we have Acentra's contact information. So we tell the facilities, if you guys have questions on the status of a PASSR, reach out to Acentra because most likely, if it was a positive screening, it's in Acentra's hands and they're working on it. So we give them their information. We always recommend to call and email just to make sure that Acentra is receiving it on both ends. And if they have a positive screening and they just want to get the ball rolling, they can fax over their medical records to Acentra and instead of waiting for them to call, because generally Acentra will reach out to the facilities within about 24 hours of that level one being submitted. But like I said, if they don't want to wait, they can call them, let them know they have a positive screening, and then just fax over medical records to get the ball rolling. For the skilled nursing facilities, we give them the TAR field office contact number. And this is more so just a number to help them on the TAR submission process. But if they have more detailed questions, we tell them to reach out to IT service desk, and that's when me and my team can help out with whatever details they need. Um, for the Department of Developmental Services, we have their number here. So if the regional center has a PASSAR summary report that's inbound, the facilities can reach out to DDS directly and ask them to expedite that if they need. And then, like I mentioned before, for the state fair hearing process, we give them CDSS's number right here, so they can start that state fair hearing process. Next is the enrollment tab. So this is how the staff who are at the facilities enroll in the system. We have two different roles. The approver is like the admin, and the user is the standard role. Once they have approvers in our system, they don't need they don't need us to add any users. The approvers can add users within the PassR system. So as long as they have, we recommend two approvers per facility at least, then they can get the ball rolling on that. And some facilities have all their staff as approvers, which is perfectly fine with us. Then we have the login tab. So this is the portal that they can log into the PassR system with. Minimum browser settings, and then we give them troubleshooting steps on any issues they might have getting into the system. Then we have training. So this is the page you all can use as well. We have an event schedule. So any one of these links will let you RSVP for that training, and we let anybody join. I mean, we send these out to everybody. Generally, the format is we have most of the time dedicated to the training material, and then we leave time at the end for questions and answers. And then we do have a few trainings where this one, for example, the file exchange, we do a demonstration on how to do the file exchange. It only takes like 15, 20 minutes. So we spend the remaining 40 minutes just doing Q&A for any questions they have. And then we have PassR Q&A hour, which is just an hour dedicated to answering any questions. And both of these trainings, we have one of our clinicians sitting in to answer any clinical questions that come up. So we update this for every quarter. So we have it through the end of December. And we update it towards the end of the calendar year. So mid-December, we'll be updating this for the next quarter. So these are all the videos. The overview training is kind of like this one, where we go over why PassR is necessary for the facilities. So say, for example, we have a facility that has been discharged into the SNF lately, but they're not in the system. We'll have them watch this video so they understand why they need to be in the PassR system. Online system navigation is a video showing the staff how to use the PassR system. So we go over every page, every link, every button. We have the Microsoft Azure organization settings tutorial, and this is a tricky one. When staff are activating their account for the first time, sometimes they don't see the button they need to access the PassR system. So this is just a video to show them how to make that visible. The file exchange tutorial, like I said, is a video dedicated to the file exchange. The same thing we do in our live training. Sometimes facilities tell us, oh, we're trying to get our PassR from the hospital, but they haven't file exchanged it yet, and they say they don't know how to do it. Well, now they can send a link directly to that hospital saying, hey, this is how you do the file exchange. Please send it over. And then we have a live training that we recorded from 2024 when we updated our level 1 screening. So the level 1, level 2 training, we go over the level 1 screening and how to get the 4 different possible results for it. And then we go over the level 2 process. So what happens after a positive level 1 screening submitted. So if you guys want to watch that, we address those topics there. And then for training materials, the first one is the Microsoft Azure registration manual. It's basically steps for the staff on how to activate their account. We have the online system user guide and the level 1 assessment. So these are basically PDF versions of some of the training material up here. Scrolling down a bit, we have the request for reconsideration. So that process I mentioned where they can submit the online form requesting a change for a closed case. We give them step-by-step instructions on how to do it. And then in case of emergencies where the system's not running, we give them a PDF document that they can fill out and send us. For the FAQs, the way this works is there's main topics and subcategories. I always tell folks, read the subcategory, see if there's any subject there that kind of fits what they're looking for or what their question is. And then I tell them to click the link. And instead of scrolling through the entire page, they can hold down Control F, start typing in their keyword, and it will find that whatever they typed in on the page. They can use the arrows to skip through the page and see if that wasn't it, where else that information pops up. But one of the questions we get a lot is, what is the exempt hospital discharge? So in the FAQs, you can see the question. and you can see the answer here. And we do break down that they need to, have it submitted within 40th calendar days of admission. So that 10 days is counted for. Um, but yeah, I always tell staff when they have questions, go here first because it'll be quicker to get their answer here. Not saying that service desk and us aren't fast when we respond, but you don't have to wait for anybody with the FAQs, right? Um, and then the information notices. So this is another one that you guys would probably benefit from. Um, all of the policy changes are in here. The latest one is kind of in the middle because we were working on it for a while, and that's our cheat sheet. So this one is for the hospitals and the SNFs. We tell them what resolutions are acceptable for admission to the SNF. So in the PASS-R system, um, it's basically the outcome or the status of a case. So all of these mean that the case is closed and it's closed in the correct way. And then we give them examples of resolutions that either mean the case is not closed or the case did not close correctly. So say, for example, Acentra was trying to reach out to the facility to screen to see if that level 2 needs to be done, if the evaluation needs to be done, and staff weren't picking up for whatever reason. So our contractor does try multiple days to reach out to the facility, and if no one's answering the phones, then they'll close the case as attempt unable. I forgot what the exact attempt letter is. It's attempt. I don't know. They couldn't reach him. It's attempt something. They couldn't reach the staff. So we break down all those different examples here. So exempt hospital discharge, we go over that again here. We even show them on the letters that are produced. We highlight where the information is they're looking for, like the actual sentence or text describing what needs to be done. And even for those situations where the resolution isn't acceptable, we also describe what they need to do. Most of the time, it's just submitting another screening and starting the process over, or reaching out to us, giving us contact information for the person that needs to be for Acentra to reach out to. So the information notices are basically in like a summary format, and then we go into more detail about the subject matter. But of course, it doesn't hurt to read all of these so you can see what California PASSAR has been up to. And that is it for the web page. So Candace, I can send you the link to that if you want later, but um, yeah, that is basically it. That is California PASSAR from a bird's eye view. Still no questions?
I have a question, Thomas.
Great.
Examples.
So, Thomas, you mentioned after the determination, it's up to the facility to decide what services are applicable to the resident. So would you expect the facility then to have some type of IDT meeting to actually have a discussion with their provider and with the other members to see what kind of services should be provided to the resident while they're in that SNF setting?
That's a fantastic question. I'm not sure. I should have had one of our clinicians join this one. I'm not sure what the exact process is, but my understanding is um even though certain services are recommended, there's additional steps or additional um I don't know what you would, I guess you would just say steps that the facility must follow in order to enroll the patient in certain services, and sometimes they don't always qualify for those. So that's why I say it's recommended, but that's why it's up to the facility to kind of take a look. Now, I don't know if there's an actual meeting that takes place to see what services the person qualifies for, but I do know after the recommended services are listed, there are steps that the facility has to take to see if that person can actually participate in those services. But if
Thank
you
you.
want, I can take that question and then have one of our CPs write up something and respond in an email or something like that. If that's a
Yeah,
better
that'd
answer.
be good.
Okay.
I have
I'll
a
definitely
question.
do that. Sure.
I have a question. So let's say Accentra is unable to get a hold of the facility, and then they post uh that letter in the system, right? So the facility is aware that they try to contact them. So is there an expectation for when the facility should resubmit that so the process can start again?
It's supposed to be as soon as possible. So I mean, in a perfect world, staff should be checking to see when the case closed and how it closed, but they don't always do that. It seems like certain facilities have staff do certain things, like certain staff submit the screening and that's all they do, and then someone else follows up. And then I've seen other facilities where the person who submitted is supposed to follow up and they don't. Maybe just they're just busy. But it's supposed to be as soon as possible because remember, for the SNFs, they're not getting paid until the close date of that PASR. So if they admitted somebody Monday and the PASR didn't close until Wednesday, then the field office isn't reimbursing for Monday and Tuesday. So that's how it's supposed to be. And the SNFs are aware what resolutions are not okay for admission. So they're supposed to be telling the hospital if the hospital tries to file exchange, like that attempt unavailable resolution. They're supposed to be telling the hospital that's not acceptable. They need to resubmit a PASR so that they can get the correct resolution going. And they've been doing a lot better about that lately because we've been seeing it in our trainings. But that's how it's supposed to be in a perfect world.
I have a question, Thomas. For myself, just looking at these classrooms and facilities, a lot of times they're not filled out correctly or, based on the residents' background and medical diagnoses. And I'm assuming just from what you're looking at, you're showing us that the facility has had trainings and access to understand what that process should be. Do you see that a lot? How is that addressed?
We do see that. And the way it's addressed is because it's usually the skilled nursing facility that reaches out to us because they're the ones that have to deal with it. So they reach out to us, they let us know what facility is doing what, and if they're seeing a pattern of something being done wrong. And then we usually do specific one-on-one trainings with the staff there. Depending on how bad it is, we might send an email to all the staff in the PASR system for that facility, letting them know what they're doing wrong, or we'll reach out to somebody and schedule a training with them. But same thing, if you guys see anything that looks weird from a specific facility, you can let us know and we can reach out to them as well.
Yeah.
And what do you guys mean by the level 1 not being filled out correctly? Is there just information being omitted, or is it just blatantly wrong, or what's happening exactly?
So like from my perspective, there's questions that either weren't filled out, left blank, regarding like diagnosis, or, I've had one resident was autistic and they're not really looking at their diagnoses and filling them out there. This is not even represented in the document. Or schizophrenia not represented in the document.
Got you. Okay. I'm going to put up that extended definition for SMI because what I have seen is the SNFs were telling us that the hospitals weren't filling out the level 1 correctly in some circumstances. And what the hospitals were doing was they're following the definition here for SMI. So if they didn't trigger the functional limitations aspect and recent treatment aspect, they were leaving that information off the level 1, which is okay by PASR standards, because they don't want to slow down that transition from the hospital to the SNF if it's not necessary. So that could be what's happening, but honestly, what you're telling me sounds like just something else. Something else that's not supposed to be going on. But yeah, here's the definition for SMI in its completion here if you guys want to read that. Let me know if you need me to zoom in. And I can explain the functional limitations, recent treatment aspect, or give you some examples. So one of the best examples I had was somebody had a diagnosed serious mental illness. They were on psychotropic medication. Their screening triggered positive. They went to Acentra. Because there was no functional limitations or no recent treatment, Acentra determined that there's no need for them to do an evaluation. It closed as attempt no SMI. If the hospital had left that information off the screening, because it technically doesn't apply under the definition of SMI, then it'd be the same result. It would just be a negative level 1 screening. So we've been telling the facilities that they don't have to put that information on if it doesn't fit the definition here, because ultimately the same thing's going to happen. And they're going to close it right there. And just a heads up, we are reworking our level 1 to kind of combat that issue right now. Any other questions?
I'm curious if you guys see a trend. I feel like we see it quite a bit, but the resident will be admitted to the skilled nursing facility, and all of a sudden they have a diagnosis of schizophrenia. And then they're submitting a new PASR.
So you're saying like the hospital didn't input the information, then they get to the SNF and the SNF submits a new screening?
Yes.
Okay. We have seen that a little bit, yeah. And that's part of the reason why we want to rework that level 1 to just make it clear for everybody. We've kind of gone and so basically our level 1 started off with more questions. I don't know if you guys remember the way it looked a few years ago. And we tried to trim it down a little bit to try and speed up the process for the folks filling it out in the facilities. At the same time, we thought we were casting too narrow of a net and we were missing certain folks that might have a diagnosed SMI or possible SMI. Looking at the data in our system for how the cases are closing, we think our net was cast too wide after we made the latest changes. So we're adding in some more questions to kind of fine tune the result a little bit. So we'll see how it works out, and we'll let you guys know when it's live. But the only way we know it works is looking at the data to see how the cases are closing. But it should address that with the hospitals filling out the level 1s a certain way and then the SNFs needing to do an RR.
Thomas, is the RR like the same question that the hospital, so there?
Yep. So yeah, it's tricky. It's the exact same screening. The only difference is when it's submitted. So the hospital's doing it before admission, and then the SNF's doing it as an update since they're already there. Same process, same flow, same everything.
All right, I'm gonna do one question.
Yeah.
Okay, if the recommendations, like what Afshan was mentioning, are not addressed or like looked at, followed up on anything, do you guys have recourse for that? Do you follow up with the facility?
That's a good question. We're actually working on that. I don't want to go into too much detail, but yeah, we are working on that. We're looking at uh the data and trying to figure out the best way of, let's just say, assisting the facility.
Because from what I've seen, they don't even, like, they're just uploaded into the profile. No one's actually looking at it. It's like medical records and they don't even know really what it was, and
Right.
the resident doesn't get any services.
Yeah. We're seeing similar things. We have some plans. There's a lot of moving parts on our end, and we can't make too many changes too soon. But yeah, there's updates to the system we have planned for that specifically.
You guys don't have any kind of enforcement authority though, do you? So if you're seeing things, is it just education to the facility?
We do have authority, in addition to, the partners that we work with, like the hospital association and everybody that's involved. But we do. We have some authority. I don't know how far it goes. Like, I don't know if we can send a letter out to a facility demanding X, Y, and Z, but we do have some authority. I haven't
that
seen it
probably-
flexed personally. You know what I mean? So
That probably, yeah, falls more on CDPH then.
a little bit. I didn't want to say it, but
I
but
mean,
you
we,
know, you're our partner, so we would work together on
of
it.
course,
You
yeah. We don't mind doing that. Yeah, so I think I mentioned to you, Thomas, we look at that on our research, so all the residents, we're looking at their PASSR, so thank you. We really appreciate this training.
Yeah, no problem. Like I said, if you all have any questions, you want to dive a little bit deeper into anything else, just let me know. We can set up another one, and get that going. All right,
Any
so is
other
that it?
I don't think we have any other questions right now.
All right. Well, that's the end of the slides here. Do you want a copy of this? Keena, is it okay if we send a copy of this? I mean, it's recorded, so we'll send you a link to the recording once it's uploaded to our YouTube page. But do you guys want a copy of these slides as well?
Yeah.
Okay. So I'll stop the recording now.